is the role of a therapist when implementing ERP?
So it's a really interesting question. I guess I've never thought about it. My role, but this is my role always. So my role as a therapist in general is I'm holding my clients accountable for whatever we're working on. And this
Okay.
is not in a mean way. For some reason, therapists think accountability equals bad rapport. I don't know why, but like for some reason, if you're holding people accountable, you're going to be mean. I'm very sweet. I'm very warm about it. I'm like, why didn't you do your homework? I know we talked about this, but you didn't do it. Why is that? It can seem abrupt, even for me inside. I know I'm being really warm and kind about it, but it can feel like, oh, I might have upset them. And so I often, my role is just different. I explain how I work. Like I'm about accountability. I'm about like the homework and figuring out why you couldn't do it. Was the ask too big? Do we need to lessen it? My role, it's just different. It's not just about warmth and understanding, even though I'm very understanding because people with OCD sometimes obsess about if they're a killer. So I'm very warm about that stuff. Those are scary things to imagine about oneself, especially when they're not. It's so terrifying. And so, and that they're going to lose control maybe and kill someone. So I want to be warm and understanding, but I also want to, I call it like a funnel. I want to channel them towards change.
So I'm hearing like an ideal clinician in this role would be non-judgmental because there's a lot of shame that comes with the obsessive thoughts and sometimes the compulsive behaviors. But they also need to have a certain level of confidence and comfort in therapeutic confrontation because it's not on the street confrontation. I'm pointing my finger at you, but it is a why didn't that happen in between session? And they also have to have a good memory because I know some therapists operate like we're going to make the most of our time together in the 60 minutes that we have. And like we may pick back up again or we may start fresh with our next session. With ERP, it is we got to make sure we are documenting and documenting it in a way that is therapeutically valuable that helps us remember what we're doing in session, but we have to know what we did last session. Like we have to follow up. We have to be accountable to ourselves and to the practice and to the session. So a really good clinician would have to kind of possess all those characteristics.